Hello and welcome to this National Pathology Week video. My name is Dr. Susie Lishman and I'm President of the Association of Clinical Pathologists. This series of videos on pathology myths and misconceptions was recorded as part of National Pathology Week 2024, an annual celebration of the vital role that pathology plays in everyone's healthcare. It was developed by the Pathology Alliance, an umbrella organisation of all of the UK's pathology societies and organisations. In this video, Dr. Charles Van Heyningen will explore the statement, "A normal blood test means you're healthy."
So it's a pleasure to be able to say something about my own specialty. And this, in fact, covers not only chemical pathology, but a whole range of specialties which are grouped together under laboratory medicine. So as you see, the myth is that a normal result, blood test result, means that you are healthy, that you don't have disease. I thought it's helpful to start off by just having a look at the word normal. If you look in the dictionary, you'll find a number of other words that describe normal, such as ordinary, or as expected, or typical. And some of these other words are probably better at describing blood test results because they may be less misleading. If we go to the next slide. Earlier this year, a book was published by these two Canadians, Gabo Mate and his son, and the book is called The Myth of Normal. And this is quite relevant. They describe in this book, they say that we tend to believe that normality equals health. They go on to question what is normality, what is the norm? And they describe the rising tide of mental illness throughout the world and the high prevalence of high blood pressure in some parts of the world, and that the majority of Americans are taking at least one drug by prescription. So they say that diseases and trauma define how we live, and that it's very difficult to separate normality or from disease or ill health. Next slide. This is a publication by two Italians, Lippi and Plebani, entitled False Myths and Legends in Laboratory Diagnostics. They describe a whole range of myths, false beliefs. And I've just picked out a few examples here. There is one, this is a chemistry test called troponin. And originally this was developed to detect heart attacks or infarction of the heart. But a raised level does not necessarily always reflect myocardial infarction. Another false belief is that screening for cancer with a test called prostate-specific antigen will be of benefit to the patient in that it decreases mortality, improves the quality of life. We know that that is not always true, and there is a fair bit of controversy about the use of this particular test. And the third example, which I've picked out here, is the one I'm going to describe in a bit more detail, and that is that laboratory values within reference ranges are always normal and vice versa. So let's move on to the next slide. Just having a look at the normal range, which is more commonly called the reference range nowadays, because it's less misleading if you describe it as referring to a particular set of measurements. It's based on the results seen in the majority, 95%, of a presumably healthy population. And if you look at the picture at the bottom left-hand corner, you can see a histogram showing the distribution of normal results in about 2,000 people, with the 95% limits shown in the dotted lines. And it's known that people with results outside of this range may be healthy, or the other way around, that people with results within the range may in fact not be healthy and have a health problem. So again, if you look at the picture, you can see the black dot on the side of the histogram, and that, although it would go with being healthy, it also could be somebody who's got a disease. Another important consideration is that normal ranges, reference ranges, may be different for different groups of people. So there may be differences between men and women, between older people and children, for different age groups. So you can see down here for boys, the range for a measurement called alkaline phosphatase will vary at different ages because bone growth influences alkaline phosphatase activity. So age can make a difference to what would be regarded as a range for that age. Next slide. Here you can see a typical example of measurements in a disease versus the same measurement in health. And you can see at the top that there is often a considerable overlap between results in disease and results in healthy people. And again, at the bottom, this is represented in these graphs showing the overlap zone in yellow, which is representing the area of uncertainty. Results in that area could be either part of being healthy or part of a disease. Next slide. So here we got an example. A blood test is taken from a patient. And even before the sample gets to the laboratory, there are factors that might influence the results and give you abnormal results. So the cuff being put on the arm to help obtain a blood sample, if that's left on too long, that can influence the chemistry in the blood. Or if the wrong tube is used to collect the blood sample, that again may interfere with the measurement and give you false results. But if those pre-analytical factors have been excluded, then you can have more confidence in the results produced. So here you've got an example of a report of what's often called a kidney profile. You can see that both serum sodium and serum potassium are in the green normal ranges. But serum creatinine is well above the normal range in the yellow zone. And then there is a bit of an explanation on the side of that, calculation carried out to interpret that creatinine result, saying that it is consistent with a certain stage of kidney disease. So this is quite a helpful way of looking at normality and abnormality, in that a report can add additional information about what it might mean. Next slide. Another good example is vitamin D measurements. Vitamin D status is usually assessed by measuring 25-hydroxy vitamin D, and results less than 25 units indicate deficiency. More than 50 are considered sufficient, and the optimal range has been described as being between 75 and 100. Therefore, rather than use a normal range to report results, it's much more helpful to include the various cutoffs in the report on the result, including the values of the optimal range shown here between 75 and 100. Next slide. So Matthew earlier on showed us the tree of medicine, and this is another picture of the same thing, just with a bit more color. The medical specialties are shown in green on the top, and the various life sciences are feeding into the roots at the bottom. And pathology and laboratory medicine, laboratory departments are responsible for using life sciences to carry out investigations and report these to clinical specialties, medical specialties, so that they help with making a diagnosis and help with patient management.
Can I draw you to a close now, Charles?
So that is my final message, that labs should be providing added value.
I hope you enjoyed learning the facts behind that myth. You can see more of these videos on the Royal College of Pathologists YouTube channel @I Love Pathology.